Welcome to this presentation. My name is Emma McIntyre. I'm the Healthy Schools Co-Ordinator for Alun School. This presentation is focusing on the self-evaluation to whole school actions, our SHRN cycle 2016 to 2021. Alun School is based in Mold, Flintshire, North Wales, and has over 1,500 students. And we joined initially in summer 2015 and have since had 3 reports, 2016, 2018 and 2020. Our journey of SHRN has supported us in the achievement of Healthy Schools National Quality Award, October 2016, and achieving UNICEF Gold Rights Respecting Schools Award, December 2019. Now, without further ado, let's look at our whole of school approach of SHRN. So this slide shows the breakdown of our school community involvement in the analysis of our SHRN data and the contribution to our school SHRN action plan. So pupil voice is critical in the SHRN process. The more pupils that complete the survey, the more reliable the data is and the more relatable it is to the pupils, because if they've taken part, then their voice has been heard. They've got a buy-in there. So with the pupil voice, we get as many as possible to complete the survey. We also get as many as possible to look at the report and give their feedback on it and suggest actions. And we do this in a number of ways with pupil voice. All pupils in their tutor groups or through a PSE session will look at the report holistically, but also a part of the report in detail and do some form of analysis and give some feedback and recommend actions that get pulled into our house and sixth form and school councils. So each tutor group has a representative and they will then go into the House Council where they do a bit more analysis on the SHRN survey and particular areas. And then the House Council reps will have some reps that go into School Council, and the School Council will pool it all together and have more conversations about the analysis and generate the pupil action plan that I will show accordingly, along with the working groups you can see on the slide. From a staff perspective, there are meetings of SHRN taking place at governing body level, leadership team, pastoral team, curriculum team, where those conversations are a bit longer and detailed. All staff have an opportunity in meeting time, development time, to review the report, feedback their comments and suggest actions. And the thing is, the more conversations that take place, the more actions that can be proposed. And sometimes, actions can be radical, they can be innovative, they might be very simple, but unless we have these conversations and look at all the possible actions, we're not necessarily going to be thinking of what can we do in the first place. So the number of actions is critical as well to getting the conversations going and deciding on new approaches. And from the community, it's essential to have community feedback on the report and into the action plan. So we share it with our parents and carers. We also work with our organisations and other inputs to the school and agencies, such as our police liaison, school nurse. We have a community group we work quite closely with on topics as well who view it, as well as our local authority. So this is an example, from a page of our action plan. And as you can see, it only covers 2 questions and there's quite a lot of questions. So the full report itself, the full action plan, is around 25 to 28 pages on each cycle. And it's set up as though we've got the question, the figure in that main indicator column. And just before that, we have a RAG system. So green, something to celebrate, shout about; amber, be wary of. And if it's red, it's an area that does need longer conversations and does need a bit of critical thinking on it too. The key actions that are suggested from students, pupils, staff and the community get pulled together in this one document, and from there it's a record really of what's going to be done, and it gets reviewed throughout the cycle before the next survey to see if those actions are being carried out. So as you can see there with that one, looking at national trend for students who agree or strongly agree that their ideas are treated seriously in school, key stage 3 was very strong and it tailored off as it went up the school. So an example of a student action is you've got House and School Council ensuring that the discussions that are happening and the activities that are happening throughout the year do get promoted to all pupils, whether that's through tutor groups, emails, etc. From a staff perspective, ensuring that time is set aside to have those discussions and updates of what's taking place from pupil voice and feeding back on other things that have been raised. And community, pupils' involvement in community projects. So although COVID is here and it's caused challenges of how to get things done, projects with dementia-friendly schools, liaising with care homes and plastic community groups locally have still been going on throughout this period. So here it's representing the whole school approach as well. Now we do this through tutor time as well as discussions through PSE to get the feedback and generate those action plans. So with our SHRN cycle as an overview, we compare it to our previous SHRN reports. It's embedded in the self-evaluation process and SDIP, so it's referenced in the school development plan. Now, because it's such a big document, it's an electronically referenced document too, and it's not just specifically about wellbeing objectives in the SDIP, it's also about the curriculum, because with SHRN, the graphs, the topics can be used across subjects, not just in PSE, so it's helpful for now and the new curriculum that's upcoming. The action plan shared across the school community. The action plan feeds into the Flintshire Local Authority action plan, and it's coordinated across staff, pupils and the community. When actually carrying out the survey over recent years, we've done a variety of ways. We've extended registrations, we've used IT lessons, and it does depend in our school community on the year group on how they carry out the action plan. So that's definitely something for schools to think about. But the objective is to get as many pupils to complete it as possible. SHRN is brilliant evidence-informed practice. So carrying it out every 2 years, the data collected tailors the curriculum and the whole school approach. So, for PSE, if there's a topic that's flagged up, we can tailor it. We can deal with it there and then, and to support the young people in making the right choices and decisions. SHRN also supports a whole school approach to emotional and mental health wellbeing response to the framework released in March 2020, an image you can see on the right. Now, COVID has been challenging in many ways in school settings, and it led to challenges with our SHRN report 2020. Previously, it would be face-to-face discussions directly about what the report shows, what possible actions could there be. And to get all those conversations happening online was challenging, and it was thinking outside the box. At the start of March last year, School Council met face-to-face. In April, it was an online virtual meeting. So we went virtual. So for the report analysis, School Council worked in sub-teams to complete Excel shared spreadsheets of their analysis in meetings, staff and community also. So action planning took place across the school community virtually. And on the right-hand side, you can see an image of a poster, and this is what we did pre-COVID too, to summarise the key differences with our previous reports, as well as the areas are going to be focused the next cycle before the next survey. Now, something else that we've been involved in over the last academic year is NSAG, the National Student Advisory Group Trials. Now, People Voice in the Alun School is very passionate about SHRN and wellbeing, and really key about being involved in data. And this is just another angle for those who are really passionate about getting involved in research to go to the next level. So School Council have been involved and are still involved in NSAG trials, where pupils can take further our school community vision of school learning organisations. On the bottom left, you can see a snapshot of the online learning platform that's been developed by Decipher, SHRN and Cardiff University. And this provides consultation and collaboration to public health research. So schools and pupils can identify, give consent to work directly here and get logins. And with this platform, the researchers can connect and collaborate with a number of SHRN students in secondary schools to get that information on topics at a much more detailed level of the subtopics that SHRN report and the SHRN survey are about. So the pupils have really enjoyed this, and it's an honour to be part of this pilot. So please do keep your eyes out and find out a bit more. If you've got any further questions from this presentation, please do not hesitate to get in